Good morning and welcome to ETX Covered. I'm David Littman. Governor Greg Abbott says the days of mask requirements in Texas are over. He had already ended the statewide mandate, but as of Friday night, no city or county can impose their own, and any remaining schools have to drop their mask rules by June 4th. He cited the advances in treatments for people who get sick, declines in cases, hospitalizations, and death, and increased access to vaccines. For the latest on the COVID-19 vaccination effort, we're joined now by Dr. Ebony Hilton, a physician and associate professor at University of Virginia. Dr. Hilton, thank you for being here. How are you today?
Doing well. How are you?
Doing well too. Thank you. We've had vaccines in use now for 6 months. Has your opinion about them changed at all from what we've seen and what we've learned since December?
Right. What we've shown is that the effectiveness of the vaccine is held up, right? The Pfizer actually released their results of their 6 months, and so they are 91% still efficacious, which is huge. And what does that mean in layman's terms? Well, that means that it prevents you from getting that severe case of COVID-19 that lands you in the hospital, that lands you on the ventilator, that lands you within my ICU, that keeps you actually alive with you and your family. So it's been a tremendous advancement in the field of medicine.
Are you still hearing from a lot of people just in your day-to-day life who are either skeptical or doubtful about the vaccines?
Yeah, I actively seek those people out. So I think I hear from them more than usual, because I really try to engage with people on social media, or they're walking through, the street, the grocery store, asking everyone I know, like, are you vaccinated and why are the reasons that you're not? And for many people, it's more so vaccine curious and vaccine hesitant. They just want information. So I give them information like going to fightinfectiousdisease.org so they can actually do the research themselves if they need to, and talk to their primary care physician about making the best decision for them and their family.
And is it still the same questions and same doubts that you hear from people, or has that changed in the last few months?
Right. I think it's starting to change, because what people are seeing in the United States alone, we've vaccinated over 127 million people, right? And you multiply that across the globe, and we're seeing that the safety of this vaccine is holding up, that people are not having the severe allergic reaction in the scale in comparison to other medicines. And what do I mean by that? Well, the severe allergic reactions we're seeing with mRNA vaccines, 1 in every 200,000 people. For comparison's sake, I'm an anesthesiologist. We give antibiotics literally every day. That allergic reaction for penicillin is 1 in every 2,000 people. So 1 in every 2,000 versus 1 in every 200,000. The safety profile of this vaccine has been tremendous, and efficacious. The ability for it to keep you from getting sick with COVID-19 if you actually do get infected has proven itself time and time again.
But since it's about getting the vaccine everywhere, are we as a country doing better now at getting everybody vaccinated, whether it's racial minority groups or lower income communities, than we were before?
I think we are. What we're seeing is the invention of this mobile clinic era, right? Where we're seeing vaccines set up in grocery store parking lots, in churches, in school systems, literally meeting people exactly where they are. Because what we know is that we can have nationally a rate of where we say 50 to 60% of all adults are vaccinated. But if we have pockets of where that is not true, right? For instance, right now in the Northeast, fantastic uptake, where we have 50 to 60% of the Northeast, all total adults being vaccinated. Down South is a much different story, between 27 and 33% in Texas and Mississippi and Florida. And so as a nation, we have to really make sure that all of us are participating in this public health measure, because what we're seeing is that this is a community-led initiative. It's very much individual too, that we each have to make ourselves responsible for making sure we're doing our part to get us all through this next wave of this pandemic.
I was going to ask you about that next, because Texas is below the national average for the vaccination rate, and East Texas is even below that. So what happens if we continue to have fewer people vaccinated here than in other parts of the country?
Right. Well, what we know is that, again, this pandemic has showed us just how connected we are as a global society, but it's also showed us that what happens on our capillary level, in talking to medicine, at your zip code level, where you work, where you eat, where you sleep, where you pray, where you play, those are the places that if you don't reach that level of herd immunity, your risk is still there. It doesn't matter if we vaccinated 70% of the United States, but within your workspace, If that's only 20% of the persons within your job that have been vaccinated, then you have real risk that that virus is going to make its way within your workspace. And so you're not safe, you're not protected. Wearing your mask is going to be definitely of utmost importance. And so we have to make that decision again, each individual person weighing the risk benefit of COVID-19 infection versus vaccination, and vaccines will win every single time.
Well, now that we have kids as young as 12 who are able to be vaccinated, more parents than ever before have to decide what's best for them and their families. Are you finding parents to be more eager to get themselves and their kids vaccinated, or what are you seeing?
I really hope they're more eager to have their children vaccinated. Very early on in the pandemic, there was this narrative that the virus was particularly just hard on older people and those with pre-existing conditions. But what we know is that that's simply not true, especially with these mutant variants, that is impacting our children more and more. And studies are showing that even those children who don't unfortunately lose their life to COVID-19, there's about 30% of those children who recover from COVID-19 actually have these long lingering signs and symptoms of that inflammatory process that this virus is left behind. They are suffering from extreme fatigue. They're unable to concentrate and having some difficulties with their classwork now. They're having inflammation around their heart. We see that with the athletes out of University of Pennsylvania, or the incoming freshman quarterback for Georgia State that literally had to wait before actually being able to engage in physical activity because of inflammation around their heart. And what does that do to the developing body? When you think about the longevity of life, we're putting our children at risk when we simply don't have to, because now we have a vaccine to prevent that form of infection.
And what do you think about some of the incentives that some cities and states are using to get people vaccinated, whether it's giving out gift cards or free beer or lottery tickets?
Right. I honestly think that just bodes for the overall safety, right? The elected officials and the healthcare community is saying by any means necessary, because what we know is that we are not out of this pandemic. We are still burying between 500 to 800 people a day in the United States of America. We still have infections of 30,000 people, new cases a day of COVID-19. It's not going away until we reach that level, that threshold of herd immunity. And so if it takes incentivizing people, if it takes meeting people exactly where they are, if it takes having these discussions daily, that's what we would have to do. That's the only way we're going to get back to normal. And so I encourage people, if you have questions, go to fightinginfectiousdisease.org, look it up, look at the cases, look at the studies, look at the information, and make the best decision for you and yours.
Dr. Hilton, thanks so much for joining us today.
Thank you. Have a great day.